On the 13th of September, we in the Caribbean will mark the 7th anniversary of the proclamation of the Declaration of Port of Spain on non-communicable diseases. And everybody knows it, the day is known as Caribbean Wellness Day, CWD. That day marked the first occasion that our heads of governments devoted an entire summit to address a specific health issue. The declaration provides a roadmap for the pursuit of that ultimate goal of reduction of deaths from NCDs. The aim is to have a reduction of 25% by 2025. It was on Saturday morning of the summit that the Prime Minister of St. Vincent and the Grenadines, the Honorable Ralph Gonsalves, coined the term a wellness revolution after the draft of 15 objectives of the declaration had been shown to him. From that day and onwards, the peoples of the Caribbean have sought to commemorate that historic day of the summit with activities fit for the reduction of NCDs. That historic first in the world summit of heads of government dedicated to health catapulted the Caribbean into the forefront of global advocacy for the reduction of NCDs. That advocacy actually spawned the 2011 political declaration on NCDs at the high-level meeting of heads of government and the state and the United Nations headquarters in September 2011. That political declaration, with its many similarities to the Port of Spain Declaration, has given birth to a global movement aimed at reducing the impact of precursor factors of NCDs. Caribbean people have honored this day in many ways over the last 7 years, from the promotion of fitness events to the use of nutrition demonstrations intended to promote healthy eating. No doubt this year we will have similar activities reflecting the zeal of Caribbean people to remain healthy. Let me, however, pause to say, though, that many or much remains to be done in the two other areas of primary prevention, which were embraced by the heads of government. Firstly, with respect to tobacco consumption. Only 4 of our countries have reformed or piloted legislation to curb the incidence of smoking: Barbados, Jamaica, Suriname, and Trinidad and Tobago. Part of our duty as officials of this community has to be finding creative ways to bring other member states to the table of tobacco prevention, supported by the relevant legal frameworks. I also understand that in the last few days, regional experts have been meeting at CARFA to prepare a roadmap to address violence and injuries. I'm advised that alcohol abuse presents a major causal factor in road traffic fatalities. We all have the duty to support the position of the heads of government adopted since 2005 on the promotion of responsible alcohol use. This will not only reduce traffic fatalities and injuries, but incidents of domestic violence and suicides also. Our region has to change its orientation towards excessive alcohol consumption, still thought of as macho in many communities. Alcohol use and tobacco smoking are also used to deal with stress and to avoid having to deal with problems. Constructive policies towards alcohol abuse will serve not only to reduce NCDs, but also, as I mentioned, violence and injuries. I want to pause here and thank the organizing committee of this week of wellness activities, in particular Ms. Jessie Malcolm and Ms. Vanessa Stephanie, and the representatives of the several houses, yellow, blue, green, orange, I think, yes. I have noticed that the wellness program is comprehensive and intends to promote, besides healthy lifestyles, inclusiveness in the CARICOM Secretariat's family. I would like to ask you to start our activities as follows. Can you please stretch your left arm, put it on the shoulder of the next person next to you. Let me see if it's going. You need some space. You need some space. Please see if it's going. Over there. Stretch, huh? Not like this, but like this. Okay, this. Okay, good. This is my left. Make a step in the left direction. Good. One step. Okay? Then you make a step forward. Good. Thank you very much. You step back. Step back one step, yes, and then you make a step in the right direction. Right. Good. Thank you very much. That's the start.